SeniorLivingGuide.com podcast discusses topics which are relevant to the everyday lives of seniors and their caregivers. We are joined by experts who share their knowledge on a variety of issues. SeniorLivingGuide.com podcast offers solutions and resources to create the best quality of life as we age. And now, let's welcome your host, Darleen Mahoney.
Does the idea of searching for senior housing solutions seem overwhelming and you're not even sure where to begin? SeniorLivingGuide.com makes senior housing search, home care, home health, as well as many resources available to you right at your fingertips in one easy-to-navigate website. So visit us today at SeniorLivingGuide.com. And I would like to express our gratitude to the SeniorLivingGuide.com podcast sponsors, Terabella Senior Living, where seniors unlock a richer, more rewarding lifestyle for assisted living and memory care in a warm, welcoming environment. And LiveDry. LiveDry adult incontinence products designed for moderate to severe incontinence issues. LiveDry provides reliable all-day and all-night protection. Quick absorbing, high capacity, and odor control helps you feel more confident when you wear LiveDry. Today, we are joined by Dr. Fabi. He is a board-certified, internationally renowned, fellowship-trained joint replacement specialist and innovative pioneer in the field. He trained at the prestigious Rush University, a world-renowned joint replacement center, where he mastered cutting-edge techniques for treating complex joint disorders. As an early adopter and recognized expert in robotic joint replacement, Dr. Fabi has contributed extensively to the field through published articles, book chapters, and national lectures. His expertise and commitment to advancing joint replacement surgery has made him a leading authority delivering exceptional patient care. I'm so elated to have you join us today.
Well, thanks for having me. Really appreciate this opportunity. I'm really excited for it. I'm all about education and, spreading awareness, spreading the word out because, hey, the more that we know can really help our health, particularly joint health.
Yeah. And I know that one of the reasons why I really want to talk about this subject is because I have some friends, and they're slightly different age groups, but had knee replacements all around the same time. And it kind of seems like it was a tale of three different knee replacements.
Yeah.
So I really thought, and one was very, very difficult recovery, and one all of a sudden it's just snippety snap, getting the other one done, happy as a clam. So I think it's an important subject because people are getting knee replacements. I mean, much more significantly, it feels like anyway, or maybe it's just my age, more often than they used to.
Yeah, and so the amount of joint replacements that we're doing in the United States each year continues to grow, and it's growing at an exponential rate. I don't know what the exact numbers are, but by 2030, it's going to be pretty significant. So that's why we're seeing a lot of higher volume in terms of what we do in regards to knee replacements. Furthermore, people are getting intervention earlier than in the past. It used to be like, wait till you're this age of 65 or 70 before you get a joint replacement. Wait till you're on a cane or a walker. But these days, we're it's about quality life, and people don't want to wait to get to that point. There's certain sports that they're not able to do, and that's important to their quality of life, and they want to get back to that. So.
Yeah. And even
and
just
plus the baby, Sorry, go ahead.
Even just walking around, I think that, you know, people that are experiencing pain, they're less likely to just do the everyday things of like exercising, bike riding, going on vacations where you're walking a city. I mean, you're miserable if you're doing all that. So do you think that it's, so they're starting to do knee replacements earlier than they used to? They used to wait till it was severely deteriorated before they started making those decisions to move forward?
I think that's a part of it. When I first started residency about 20 years ago now, crazy, a little over 20 years ago, yeah, we were kind of a little more gun shy than we are to offer joint replacements. But I think also a big part of that is that the baby boomer population, the largest generation that we've seen, is now entering that demographic,
Mm-hmm.
that and that age group where they've tried everything and they're candidates and considering knee replacement surgery. So it's multifactorial, but I think probably the largest factor is that generation that I just alluded to.
Right, right.
Yeah.
So, why would someone need a knee replacement? Is it because they've used and abused those knees, or is it just arthritis or deterioration through the years or bone on bone? I mean, I don't really know what causes. I'm sure there's a variety, but just in general.
Yeah. Well, I hear a lot of surgeons, and I don't like, for me, I don't like to use the word need a knee replacement. I tell my patients that it's like, you can live with arthritis. This is not one of those surgeries like cardiac surgery or, God forbid for that patient, anything intervention with regards to cancer, because you need those surgeries.
Yeah.
It's an elective surgery. It's an option. But patients that are candidates, usually, we always want to offer, and we want to start with conservative management, because I tell all my patients, you'll know when you're ready for surgery. I'm not one that pushes surgery, because people can get by with physical therapy, with taking anti-inflammatory medications, injections, whether it's cortisone injections or what we call hyaluronic acid injections, which is essentially a gel that you inject into the knee joint to lubricate the joint. And now you have other interventions that are kind of getting more and more, quote unquote, popular. I don't know if popular is the word, but
Like
kind of
mainstream?
more considered is like PRP, or
Okay.
platelet-rich plasma and stem cell injections, which right now the literature is controversial on whether they work or not. Issue with that, it's a cash pay thing. Insurance doesn't cover it. Not something that I believe in right now because in my experience, the results are not that great. So I'm not one that likes to get cash for the sake of getting cash,
Yeah.
but there are doctors that I tell my patients if they're interested in it, do your research, find people that say they have good results, get some referrals, but just know that you're spending that money and, there's a good chance it won't work.
Yeah.
So,
I mean, you have to always do your due diligence
yeah,
anytime you do any kind of medical procedure, regardless if it's cash or not. But if it is cash and your insurance isn't paying for it, you really need to do some due diligence because
absolutely.
nobody
Absolutely.
wants to throw their money in a black hole. So,
No, especially these days.
100%,
Yeah.
100%. So I feel like one of the things that I remember way back in the days, I had someone that I knew that had a knee replacement. He was like in his 30s. He had like I guess a really bad football injury. And I remember him coming into work with like a huge contraption on his knee. And then the recovery was like 6 months. And it was, we've come a long way.
Yes,
Is
absolutely.
what I'm
Absolutely.
getting to.
Yeah, no doubt.
So what do you think as far as like technology advancements that have really made knee surgeries with a shorter time frame, less pain, or whatever the case may be? And are there different procedures? Because I know that they have different cuts per se that might be less painful, more painful, that kind of thing.
Well, I forgot to finish that last question. With regards to people that are candidates for joint replacements, it gets to a point, I tell my patients, like I said, you'll know when, and that means a lot of different things to a lot of different people. Some people will actually wait till they're almost wheelchair bound, and I get that. Surgery is a big decision,
Yeah.
and it can be scary, especially if you've never had surgery before. I mean, a lot of people haven't had knee replacement surgery before, so it's that fear of the unknown. But once their quality of life gets compromised, I have people that it can be as something as like I can't play golf anymore, and that's their indication to undergo surgery. And people just know when they get to a point where like, all right, enough is enough. I've
Yeah.
tried all this non-surgical treatment options, and I'm like, my quality of life is not where I want it, and
Yeah.
I want to get a more permanent solution. So those are patients that are candidates. And going back to age group, We do have people that get joint replacements in their 30s, 40s, 50s is, not heresy like it used to be, because these are some of the more active years of your life, and, you know, um, to say wait 30 years or 20, 30 years to prevent a surgery, a second surgery, doesn't really fly
Right.
anymore
Right.
because what are you going to do? You're going to suffer for 20, 30 years. And philosophically, not to sound morbid, there's no guarantee we make it to that age, right?
No.
So it's like
No.
live your best life,
Exactly.
So
Yeah. I think the
now
kids
with
call that YOLO.
exactly, I was just going to say that, yeah. um, so going back to what you said about technology, um, there's a lot of work, both industry and surgeons, to really improve what we're doing with regards to knee replacements. Classically, there's been a 20% up to a 20% dissatisfaction rate. And
Oh,
a lot of
wow.
that, yeah, yeah, yeah.
Wow.
But, we really kind of brought down those numbers. What we saw, a big thing that we saw is that, and you may know, hip replacements tend to recover a lot quicker than knee replacements, and the satisfaction rate's higher.
Yeah, you shared that
Yeah,
with me. I was so shocked by
yeah,
that. And that's
yeah,
that's amazing, especially for our senior population who
yeah,
who struggles
yeah.
in that area. Yeah.
So, being that we're like type A personalities, we want to kind of, 20% dissatisfaction is what, like B minus work, because you're hitting 80%, we want to get
Yeah.
in the A plus range.
Yeah.
So we really want to kind of bring that delta down. So, and, so a lot goes into that. Number one, I trained in an institution. There was one of my mentors, Dr. Richard Berger. He started doing outpatient joint replacements probably over 25 years ago, meaning going home the
Hmm.
same day. And
Wow.
initially that was thought as heresy, but he was a true visionary. He saw there's really not much that we were doing for these patients in the hospital.
Hmm.
So a lot of it's mental. It's kind of planting that seed, because
Hmm.
if you tell a patient, you got to stay in bed for 2 or 3 days, you have to go to skilled nursing facility, they're going to believe it.
Hmm.
Whereas if you tell a patient, we're going to get you up the same day, you're going to go home the same day, that really sets the bar for their recovery. Meaning, oh, I can do this day one. This should be a lot quicker than say in the past where it's going to be months. So a lot of that, 95% of the recovery is mental, particularly when it comes to knee replacements. Us surgeons, we can do a great job, but it's a two-way street. That patient has got to do their work. They got to do their rehab, and that's makes for the best formula. The people that are motivated to do their exercises, do their therapy, tend to
Hmm.
recover quicker.
Yeah.
Also, our technique with regards to how we dissect down to the hip, to
Hmm.
the knee joint, our incisions used to be a lot longer. So
Hmm.
what does that mean? There's more collateral damage to the soft tissues that we get in there. So now our incisions are smaller than in the past, and that means less soft tissue that has to heal. And our design of our implants are significantly a lot better than they were even 5, 10 years ago as a whole. Because the knee is considered a hinge joint, right? And a hinge just goes like this. But actually, the true hinge philosophy goes like this. But actually, a normal knee doesn't just do this, it kind of rotates as it goes back. So
Right.
that's always been a conundrum in our industry as to how we reproduce that motion.
Right.
But now, finally, with implant technology, we're able to recreate that motion.
Hmm.
So at the end of the day, taking it back to the basics, we want to recreate normal. So before we were not recreating normal, we were actually recreating abnormal, and that can lead to dissatisfaction rate. But now that we're able to hit that range of motion, our recovery has been a
Hmm.
lot better. And then we also have computer technology that we can utilize at the time of the operation. Robotics has really come to the forefront.
Hmm.
And what that does, it's a game of millimeters, a game of degrees, in joint replacement surgery. And if you're off by a few degrees, if you're off by even a few millimeters, that can lend itself to a poor result.
Hmm.
So now with these new technologies that we're having, we're able to hit that target zone. There's been studies that show just naturally there's human error, right?
Hmm.
If you do it with standard, just regular instruments, you can hit precision accuracy rate of max 90%.
Mm-hmm.
And I'm not talking that we're going way off the reservation with our alignment or with, our angles and stuff like that. But now with these new technologies, we're hitting 98 and 99%, which is huge. We don't have as many outliers. So kind of doing the math, say you do 1,000 knee replacements a year. I don't do that many, but I know there's some people that do. If you're hitting 90%, those are 100 patients that you're like, okay, this could have gone better. That's a lot of patients. And, I have a conscience, and that will kind of keep me up at night.
Yeah.
Whereas if you're hitting 98, 90%, 99%, you're bringing that total down to 10 to 20%. So it's up to a 10x improvement in terms of decreasing our outliers. So, and then, sorry, go ahead.
I was going to say, I wanted to ask you this question. So if anyone's that's listening that might need a knee replacement or know someone that does, when they're talking to the person that may or may not be performing that knee replacement, asking about the type of robotics and technology that they use, I think would be something, do you recommend that? Or is that standard protocol to use the technology?
Well, I think, the way, I think it's great that patients come in more educated than they have in the past. Now it's up to us as the doctors how to help that patient interpret the data, that education that they're getting. We used to have the Google doctors come in, meaning you got a patient that, you got
or WebMD, stay away from WebMD.
Exactly.
Yes.
Yeah. And they come in all knowledgeable. Now, actually, maybe I'm coining this term. I don't know. We have the Chat GPT doctors. I'm impressed about the elderly population. They've been really hardcore on the Chat GPT.
Yeah.
And they're coming in with questions that I haven't gotten in the past, so
I will say this on Chat GPT. Chat GPT I found to be wrong.
Yes, absolutely.
Yes. So, I mean, that's just a little food for thought. If you get something out of Chat GPT, it's not a guarantee. Yeah.
Yeah. Claude may be better, but that's a topic for another.
I was going to say, this is another whole other episode.
Yeah. I think at the end of the day, it's, whatever the surgeon needs to get their best results possible, because if you're a higher volume surgeon, naturally, it's kind of time on task. The more that you're able to, you get better at it, right? And your accuracy rate, your precision rate, your results get better. Now, if that surgeon is comfortable going standard instrumentations and they're really good at it, they get good results, I think that's great, But I think just adding another layer to improving our results, I think is hugely important, So a lot of that comes down to the technology that surgeon uses. So I think it's a great question for a patient to come in and ask, be like, what type of technology are you utilizing? Because at the end of the day, that patient has to be comfortable with that surgeon, because that's a huge privilege, a huge relationship, a huge trust factor that goes into getting surgery done, because I've never had surgery, but I think that's kind of very comforting, very reassuring for that patient, because there's always a level of, I think, whether small or large, there has to be a level of anxiety that a person goes through going into surgery. And if they know that surgeon, utilizes all the tools at their disposal to get the best results possible, I think that's very comforting. Very comforting to the patient. Yeah.
And I think even maybe get referrals from someone that's worked with, I think that's always amazing. Anytime that you do that, you need some kind of a, referral from someone that that's had it done, or even going online and looking at the credentials or anything like that as well. I think because all that stuff is at our fingertips right now. So yeah, that's a good one.
I think a person, it would benefit a surgeon to have a large online profile, because word of mouth is still kind of our bread and butter, right? But now people are coupling that word of mouth from what they're seeing online.
Yeah.
And patients should take that with a grain of salt also, because sometimes online presence is not entirely representative of, that surgeon or that orthopedic group that they're
Yeah.
going through. I think by and large, yeah, I mean, it's very close, very accurate, of course, but, you know, just like any industry, there may be kind of some bad actors out there. So, and I welcome all my patients, the people that come see me, get a second opinion, get a third opinion. This is a huge day in your life. You need to be comfortable with whoever you go to.
If you or someone you care for is dealing with moderate to heavy incontinence, you've experienced products that leak, and that is never acceptable. Live Dry products combine high capacity with fast absorption and a secure fit to help eliminate leaks and improve comfort, even during extended wear. With Live Dry, it's protection you can trust.
Thousands of positive reviews on Amazon can't be wrong. Search LIVDRY on Amazon. Live Dry products are available at Amazon.com and Walmart.com.
At Terabella Senior Living, seniors unlock a richer, more rewarding lifestyle for assisted living and memory care, offering daily activities, homestyle dining, and 24-hour care in a warm, welcoming environment. Tour today to see the comfort and care we offer at Terabella.
No, I appreciate that. And one thing that I always think about back to like the boomer generation, sometimes they don't want to get second opinions or they don't want to question because that's how they were raised. Raised to, it's out of the mouth of the doctors, like out of the mouth of God to some folks. But I think that a doctor that's really well worth his reputation is going to welcome any additional questions and want to be able to answer those questions to relieve that anxiety, et cetera. Yeah. And then if they want to get a second opinion, I think that should be something completely that you're in favor of, just to give them that relief.
Yeah, absolutely.
Yeah.
And I think it's important again to have an online presence because, we only spend a finite amount of time with these people and with the people that come see us, and I like for me, because, with Google reviews, with social media, it's a way for people to kind of get to know me. Not just on a professional level, but on a personal level, because on my social media profile, and then that filters into what they're seeing on Google, they kind of get a sense of, who I am as a person beyond just being a surgeon. And I think that's important, because I don't want, certainly, I don't want them to put me on a pedestal, so to speak. I want it to be kind of more level because, we're all human beings here, and if they find that I feel to really establish an important connection with that person on a kind of more level basis, I think that increases the trust factor, and that mentally, because I think 95% of the recovery is mental, that kind of really, really, really helps their recovery.
Yeah. And I do think also there's that huge level of comfort when you are meeting with a physician where you don't feel nervous or don't feel inferior, where you do feel like you're relatable. I think being relatable, I love the idea of that. So, because you don't always get that.
No, unfortunately, so, and everybody has their own personalities,
Sure.
I'm not, hey, whatever works, and, I just, I think I believe in authenticity, and I just like to be myself, and I think that goes a long way.
Yeah. No, I absolutely appreciate that. And I hope our listeners will as well. I do want to kind of switch topic a little bit regarding are there different types of incisions that are, there's I think that there's and correct me if I'm wrong, because I actually don't even know the answer to this, different types of incisions that could affect in different ways. So what are those different kind of options and the outcomes of those?
Yeah. So, incisions as it relates to knee replacements, I would say primarily there's two. There's, I think most common is that the incision down to the knee.
Basically just a cut right straight down from the top of your knee to below the knee.
Exactly. So
in a
it's
nutshell.
going Yes, it's going straight over the kneecap. And whereas the way I was taught, I go to the kind of more to the side. And, it's not like one is better than the other in terms of incision. I just was taught that going to the side, you can make that incision smaller. And I'm not saying small incisions is the end all be all. I think at the end of the day, you want to put in that knee replacement, that implant as accurately and as precisely as possible, regardless of what incision that you use. I think the incision kind of more comes into play as to how quickly they're going to recover. So doing one straight down the kneecap, number one, I think, and it doesn't happen all the time, but that incision going straight over the kneecap can make it a little more difficult because you can have a painful scar there and make it a little more difficult for patients to kneel once all the recovery is done, which is a common question that I ask is like, can you kneel on the joint replacements? And the answer is absolutely yes. Whereas going to the side, I'm not doing that incision over the kneecap. So that means we don't have to worry about that factor of a painful scar getting in the way of their ability to kneel. So that's incision. And then there's more to just the incision. It's how you dissect the deep tissues down to the joint. Okay. Some people will, kind of cut a little bit through the quadriceps tendon, whereas other people will kind of not do that. Now, it's controversial whether is one better than the other. Honestly, we don't know, but I don't like to cut the quadriceps tendon, and some studies show that leads to a quicker recovery. And also another thing is to get good exposure, to get visualization of the knee joint, you can either put the kneecap, slide it to the side, or you can kind of flip it, what we call evert the patella. And that makes the surgery, you get a little more exposure, a little more ability to see if you flip the kneecap. But if you think about it, that can really stretch the tendons, your patellar tendon, which attaches your kneecap to your tibia, your shin bone, and your quadriceps tendon, which attaches, your kneecap to your quadriceps muscle. Just imagine that kind of being stretched out when you flip the kneecap, and that can lend itself to a longer recovery. But honestly, I think at the end of the day, regardless of your incision, as long as you do a well done, accurate, precise, good implant, knee replacement surgery, I think the results become a little more equivocal. But I think the larger, as we talked about before, the larger that your incision, potentially, there's more scar tissue that can develop if your incision is a little longer and your dissection is a little bigger going down to the knee joint.
Yeah. The other question I had, and I was going to ask it in the beginning, and then we got busy talking about something different, is if you do wait longer and it deteriorates more, does that make for, to me, I always think get on top of it before it gets too bad and don't procrastinate. But is that a good practice in knee replacement, or does it really
I think
matter?
there's two sides to that coin. I think it's rare in this country that patient will finally get to the point where they're ready for surgery and their knee is so damaged, that it's gonna make the surgery extremely more complex than we like to. People will get intervention prior to that. But yeah, there's certain times where the knee is so damaged and makes the surgery a little more difficult, and it can possibly lead to suboptimal results. But I think when technology has really kind of intervened, we've been able to improve upon that. On the other side of the coin, those people, in terms of the severity and in terms of their function, are starting down here. Whereas someone who has less disease, they're starting up here. And if you do a knee replacement, you're getting them to here. So that is a big improvement there. So those are people often, I think, that will notice a difference quicker than patients that have less disease. So, those are ones where honestly you're like, and not to say that, I mean, just kind of, this is just a saying, but like, it's like, no matter what you put in this person's knee, they're going to feel better, but,
Yeah.
yeah.
I like that. And some of it may very well be insurance driven as well.
Unfortunately, yeah.
When you're able to make those calls on your knee replacement. Yeah. So really we want people returning back to activity.
Oh, no
we
doubts.
want them out there golfing. Pickleball. I can't imagine doing pickleball after a knee replacement because that's really hard on you. But I mean, it's a growing activity that people are loving.
It's viral.
And then travel. I mean, that's to me something that you shouldn't have to have a knee replacement, do all your recovery before you make plans for a trip.
Yes.
So, So be proactive.
Especially if they're going to Europe, because it's like the first thing that they'd say, I'm like, I got a European trip coming up and there's going to be a lot of walking.
Yeah.
So,
or Boston.
Exactly. So
when I think of walking on a trip, I think of Boston. There's a lot of walking and you don't want to miss a thing, but it's amazing. Yeah. So, the future of joint replacement. I mean, how do you see that? Do you see, because I don't need one anytime soon or maybe ever, but I like the idea of that we're making those improvements before I go under the knife. So I'm kind of curious what your thoughts are.
Well, there's always improvement. I love that, like what we do in the healthcare field mirrors what's going on in the outside world, so to speak. Obviously AI has kind of really blown up. Yeah. So there's already systems that are in place right now where we're using artificial intelligence to really improve our results, and that's only gonna skyrocket even more. So AI is gonna be involved in terms of, we're gonna get an algorithm, so to speak, as to how to really kind of quote unquote customize what we're doing for that patient, because everybody's knee when we were younger has some differences compared to someone else's knee, kind of how were we born. And we want to recreate a knee replacement that's working specific to that patient. We want to give them back to what their quote unquote normal knee was to the young age. Right. And artificial intelligence is going to help us hit those target points. It's going to help us realize, what we weren't doing so well, and then what is doing so well. And so AI, augmented reality, is starting to kind of really get a little footprint in knee replacement surgery. Why that's advantageous? One, it just gives us more information, and the more quantifiable data that we have doing our surgery, that can lend itself to quicker recovery, better recovery, higher satisfaction rate. So I think those are the two next things, because robotics is finally kind of, there's, I do a lot of kind of reading, not just within orthopedics, but everything else. But technology usually takes, on average, 10 years to kind of really hit critical mass. And robotics came out in terms of knee replacements about 10 years ago. So now it's kind of hitting its stride. AI, my prediction, I consider myself a futurist, so to speak. I like to keep my high beams on the future. I think AI is going to kind of get into our field quicker than 10 years. So that's where I see a lot of it, where we're going. Robotic surgery is only going to get better and better. More and more, there's going to be autonomous robots where you're just kind of dialing numbers, and then that robot is going to be doing most of the surgery on its own. And there's already technology that's out there. Now, that doesn't mean a surgeon is outside the room. No way, because just like
we don't want to put you out of a job.
Just like any technology, and I don't think a patient at this point is comfortable, not having a surgeon in the room, because there's always variations to. Slight variations to someone's anatomy, like where their blood vessels are, where their ligaments are. So it's always nice to have that person, that human being, to kind of supervise, so to speak, what that robot is doing. Because just like anything, computers, whatever, there's got to be a fail-safe mechanism, because there's glitches. There's glitches 100%. That happen, so.
Just like ChatGPT is not always
Exactly,
right.
exactly. And I think, because this is a $1 billion industry, if we, figure out and optimize what we're doing with patients with arthritis. So being that it's a $1 billion industry, there's always a lot of motivation for people to work on new things that can help joint health. So do I think stem cell therapy or, those PRP therapy, I think there's possibility there may be a breakthrough with regards to that. And meaning that we're going to be doing less knee replacements in the future. And I think that's great. My philosophy is like whatever is best for that human being. It's like, hey, what would I want, right? I don't know when or if that's going to happen, but that's always a possibility. I guess I'm fortunate also because like I'm kind of midway through my career, so if that happens, hey, I'm already looking to the horizon. But yeah,
And I think there's always adaptability
absolutely,
when it comes
absolutely.
to technology. I know that like when computers came along, because I'm definitely older than you, I'm sure, but I remember that being like insane technology, and then it dialed up and you're like, oh my gosh. And now, now we have phones that are like little mini computers. Who thought? And then Google and all the different things. It's banana cakes out there. Yeah. So it really is, it is an exciting time, I think. And I've enjoyed kind of seeing your excitement over like the whole technology aspect of it, because you're absolutely embracing it. And I think that that's key as well. So yeah, no, I appreciate that.
I think if you want to kind of have a sense of what the future holds, I'm a big science fiction fan. A lot of those movies become prophetic, so I'm thinking about like a robot coming in with lasers, and putting that small laser into a person's knee and kind of fixing their cartilage, so to speak, or even 3D printing through a small incision, a knee replacement into that patient's knee. Now, that may take 20, 30 years, 40 years, but, who knows? I think,
Yeah. I always think of the movie WALL-E. I don't know. Did you see that? Yeah. It's a kid's movie from a million times. And I remember thinking it was just so like out there. And I'm like, we're living in WALL-E world right now. So it was a prediction of the future for sure. Which is kind of crazy. So you sent me like a quote that I'm happy to share. And I think that it's super important and it's perfect for our topic. Modern joint replacement is about restoring quality of life and getting people back to doing what they love. That's all. That's it in a nutshell. Yeah.
Absolutely.
Yeah.
No doubt.
Perfect.
No doubt.
Perfect. Thank you for sharing that. I did want, before we sign off, because we didn't really share where you're locating, kind of where you're at. I would love for you to share that so our listeners, if they're in your area or what have you, and they'd like to make an appointment. So how can they get in touch with you? Where are you located?
I am located in dreary San Diego. This is my 16th year of practice. I'm involved with a private practice group, San Diego Orthopedic Institute. Our phone number is 619-299-8500. So if you choose to come check us out, come for a visit, we'd love to have you. We're here to help. Yeah.
Yeah, and I'm going to put the link as well in the description. So anyone that wants to check it out is more than welcome to do that, and we definitely invite it. So
amazing.
Did you have anything else that we didn't talk about before
I think
tap out of this
Let me think. I think that was very, very comprehensive.
This was so informative. I absolutely loved all this information. I had so many questions in my own noodle just based on like the different friend experiences. Like I said, it was a tale of like 3 different knee replacements. It was just crazy. So I couldn't figure out why that would be. So this has been really helpful in kind of getting to the core of some of those answers. So
awesome. Well, thank you so much. I really appreciate it. Really love this opportunity. And thank you for what you're doing. I think that's great. Yeah.
Oh, thank you. Thank you so much. And if you are listening to this podcast, please join us anywhere you enjoy podcasts. Comment, like, share, subscribe. We're available anywhere such as Spotify, Apple Podcasts, and more. Thanks for listening.